I'm here at the Vera Institute today to talk about my book on drugs, crime and public health, and specifically on the question of whether drug policy matters. Does the penal element of drug policy specifically affect rates of drug use or related harms? Well, I've looked at the evidence in 5 countries, so the USA, England and Wales, Portugal, the Netherlands and Sweden, and tried to see if we can draw a link between the types of drug policy they have and the outcomes in terms of drug use and related harms. And specifically I'm interested in the idea of whether if you punish drug users more, you get lower rates of drug use, because that's the justification that's used for the spending of money and the infliction of pains through the criminal justice system on drug users. And what I found is that penal drug policy doesn't seem to have that effect. There doesn't seem to be a link across time or across place between a harsher drug policy and lower rates of drug use or related harms. So, for example, over the last few years in England and Wales, we've reduced the punishment of cannabis users, and cannabis use has continued to decline. In Portugal in 2001, they decriminalised the possession of all kinds of drugs, and some categories of drug use have declined. For example, drug use amongst 16-year-olds has declined. By contrast, America has a policy of huge levels of incarceration of drug offenders, but seems to have higher rates of drug use than many of the other countries that I've looked at. So it's very difficult to say, therefore, that drug policy in its penal element has a direct effect on reducing levels of drug use and related harm. There are other effects of drug policies around, for example, treatment, and the expansion of treatment and harm reduction has been shown to be associated in these countries and others with improvements in damages such as drug-related deaths and HIV infection. There seems to be an intuitive, common sense expectation that if you were to punish drug use more heavily, then people would be deterred from it, and therefore there would be lower levels of drug use. But that doesn't seem to operate in practice. And there's some indications that that's because the messages just aren't getting through. The telegraphic use of drug law doesn't reach the people it's intended to reach, i.e. those people who are considering using drugs. They don't really notice what the law, what category a drug is in, what the law says will happen to them if they get caught. Partly that's because very small numbers, very small proportion of drug users do get caught. Even in the US, which, as I said, arrests large numbers of drug users, that's still a very small proportion of the drug-using population. And it's also because people, in that moment when they're offered a drug or they're considering using a drug, they're not thinking about what might happen to them a few weeks hence in a courtroom. They're thinking about what pleasure am I trying to get or avoid by the taking of this substance right now. So the contexts in which criminal law operates don't operate when people are making those decisions about what drugs they take. Opponents of the decriminalisation of drug possession have often said that if we were to reduce the punishment, then use would increase. But the emerging evidence from places like Portugal, from England and Wales, from those states in the US that have decriminalised and reduced the punishments, suggests there's no consistent pattern of increases in use or related harms when those punishments are reduced. As I said, there's been, since decriminalisation in Portugal, there's been a reduction in use by 16-year-olds. Since the reduction of enforcement of cannabis laws in England, there's been a reduction in cannabis use. And also in Western Australia, where they introduced a diversion scheme for cannabis possession offences, there wasn't an increase in cannabis use there either. So the evidence suggests that we could relax the enforcement and certainly the penal repression that goes with the enforcement of those laws without risking a major increase in drug use. Well, there are elements of drug policy that affect drug-related harms, such as the expansion of treatment and the introduction of harm reduction measures. So countries like England and Wales, which had an early introduction of harm reduction measures such as needle exchanges, methadone maintenance, have got quite low levels of HIV, for example, compared to the US, which has a much slower implementation of those kinds of measures. And also countries like Spain, which didn't introduce harm reduction measures until the epidemic was quite well established in terms of HIV. When they introduced those harm reduction measures, they saw a reduction in HIV. And also in England, for example, over the last 10 years, we've had a major expansion in treatment, and we're now seeing reductions in the numbers of heroin and crack users and in the levels of injecting drug use amongst that population. So that element of drug policy can be effective in reducing some of the harms that are associated with drug policy. But I'm also very intrigued by the effect of non-drug policies on drug use and related harms. And the sociological evidence suggests that it is relative poverty and inequality that is associated not with drug use, but with drug-related harms. And so drug use is quite widespread throughout society, but it's the poor who suffer most, and specifically in England and Wales and in the USA, the poor of black and minority ethnic groups who suffer the most. And so I was intrigued to look at the link between inequality and also welfare support and problematic drug use. And so I took an index of the level of welfare support through what's called decommodification, which is an index based on unemployment benefit, sickness pay, and the levels of pensions. And if you take that index and do an analysis of that index against levels of injecting drug use across countries, you find a significant statistical and negative correlation between injecting drug use and welfare support. Those countries which provide the lowest levels of welfare support tend to have the highest levels of injecting drug use. And this suggests that welfare policy is a crucial element of an effective approach to reducing problematic drug use and the harms that are associated with it.